Josie and my partners Grace Bachoven and Danica. We collaborated to make a presentation on multiple sclerosis. So multiple sclerosis, or MS, is a potentially disabling disease of the brain and spinal cord, which make up the central nervous system. In MS, the immune system attacks the protective sheath, myelin, that covers nerve fibers and causes communication problems between your brain and the rest of your body. Eventually, the disease can cause permanent damage or deterioration of the nerves. So multiple sclerosis, the signs and symptoms may differ greatly from person to person and over the course of the disease, depending on the location of the affected nerve. Some symptoms include numbness or weakness in one or more of the limbs. Typically, this occurs on one side of the body at a time or in the legs and trunk. It has electric shock sensation that occurs with certain neck movements. There can be vision problems that include partial to complete vision loss, blurry vision, or prolonged double vision. There could be slurred speech, fatigue, dizziness, tingling, problems with sexual bowel movements and bladder function, and ataxia. So ataxia describes lack of muscle control or coordination of voluntary movements such as walking or picking up objects. The assessment would include learning the patient's health history, so asking them if they have experienced any of these symptoms, and then a physical exam to see if they have any of these symptoms. So as a nurse, that would be very subjective at first. You would ask them if they had any of the symptoms, and then it would be objective when you yourself observe them having those symptoms. So the causes of MS are unknown, but getting MS is 15 times higher when the disease is present in the patient's immediate family. Pregnancy, infection, and trauma can also cause the onset of MS or cause relapse. So in this picture here, it shows what a normal myelin sheath would look like in a nerve. And MS causes the deterioration of the myelin sheath. So this is happening in what is called the lesion of your nerve in your spinal cord. The nursing diagnosis for MS is impaired physical mobility related to fatigue and weakness. There is no specific test for MS. Instead, a diagnosis of multiple sclerosis often relies on ruling out other conditions that might produce similar signs and symptoms, known as a differential diagnosis. But some tests can be done to rule out would be a blood test. This rules out other diseases with symptoms similar to MS. A spinal tap, in which a sample of the spinal fluid is removed from your spinal canal, and then that sample is tested for abnormalities in the antibodies that are associated with MS. An MRI can be taken of your brain and spinal cord, and then you would inject a intravenous injection that would contrast the material, so it would highlight where the lesion on your body would be. And then an evoked potential test, which records the electrical signal produced by your nervous system in response to stimuli. This test may be used to use visual stimuli or electrical stimulus, in which you watch a moving visual pattern or a short electrical impulse are applied to nerves in your legs or arms, and the electrodes measure how quickly the information travels down your nerve pathway. So treatment for MS, most medical treatment is designed to slow disease progression and address symptoms of the disease such as urinary retention, spasticity, and motor and speech deficit. So this would include exercise therapy such as ambulation, joint mobility, and muscle control. It would also be teaching exercise and activity programs. Energy management and environment management are also very important because you want to avoid getting the MS patient exhausted or overheated because that can cause flare-ups. There's exercise promotion, activity therapy, distraction, and there's also pharmacological interventions such as corticoid steroids, which decrease symptoms and induce remission through anti-inflammatory effects, and the immunotherapy agents, which decrease symptoms and induce remission using multiple agents. So upon discharge and follow-up, you want to really educate your patient. You need to be sure that the patient understands the pain medications they're prescribed. This includes dosage, routine, action, and the side effects the medications may have. You need to understand the needs for adequate bladder and bowel elimination. We kind of talked about this in nursing this week. It's very important to reduce skin breakdown by making sure you have adequate bladder and bowel elimination. You need to notify primary caregivers on the exacerbation or sudden worsening of the condition. And you need to teach how to avoid stress, fatigue, and being overheated. And finally, you need to determine if a home care health agency is needed to provide supervision with physical therapy support. And that is MS.